Hello everyone, we present before you IDAentity, Thane IDA branch's annual program after a gap of a year due to the pandemic. This time we present all day long hands-on various exciting topics in clinical dentistry. I wanted you to revisit old school prosthodontics, so here I am with cast partial dentures. Let's see how to make your own custom trays to record a definitive impression using a unique material for a partially edentulous arch. As always, your host and host, Dr. Amit Sadhwani. Let's take a look at Kennedy's Class 3 Mod 1 situation. I'm sure you can make an impression for it with the regular 1 or 2 step putty wash impression technique, but here I would use an addition silicone monophase, which has a dual advantage of recording hard and soft tissues due to its unique properties. We first start with a primary impression using alginate. Make sure you have those rolled borders, especially when it is a distal extension scenario. The custom tray on it can be made in the clinic using a light cured tray instantly. The basis of the tray is creating positive stops on the teeth and mucosa. It is to create an even space all over for the impression material and reorient the tray easily. Make sure you block those nasty undercuts and interdental spaces. Here we are with the monophase, which is recording the rest seats and the soft tissues evenly with uniform pressure. You may add some soft putty to fill in the bigger edentulous spaces. And here we are with the framework, a perfect palatal strap for this situation. Catch me on this Sunday morning, the 12th of December 2021, for more knowledge on cast partial dentures. We are looking at an action-packed day ahead with loads of other topics like photography, periodontics, endodontics, all from our star speakers lined up only for you. See ya!